Regina, NCLEX instructor for ReMar Review, and this video will be on the difference between Coumadin and Heparin. I always get the popular search terms the students are looking for when they come to the blog seeking NCLEX review information. And by far, one of the most popular is always the difference between Coumadin and Heparin. So I want to do this video to help you guys understand this information. First thing, let's talk about the similarities, because I think that's where students get most confused. Heparin and Coumadin are both anticoagulants, which means that they thin the blood, alright? But the differences are in how they work, how fast they work, what to look for when a patient's on this medication. So they're both anticoagulants. So that means that when we give either heparin or Coumadin, the goal is that a patient will not develop a blood clot. Now, what are some conditions or what are some disease processes that will cause a patient to have a blood clot? Right? The first one could be an irregular heartbeat. So atrial fibrillation, ventricular tachycardia. How about a pulmonary embolism? Okay, we don't want our patients to have one of those. How about a deep vein thrombosis? We don't want our patient to get one of those. So we put our patients on a blood thinner. Also, can't rule out bed rest. That's a big one. A lot of patients come into the hospital and they're complaining of chest pain or abdominal pain, and the doctors put them on bed rest. Well, what you'll see is that heparin will be given as a prophylactic against developing a blood clot while you're in the hospital. So no matter what unit you find yourself working on, you could be given a lot of heparin. Alright, let's talk about the differences. Our first difference is going to be the onset. How fast do these medications work once they're given? I want you to take out a piece of paper, and on one side I want you to write heparin, and on the other side I want you to write Coumadin, because we're going to look at the differences. So on our heparin side, the onset is going to be 1 hour. About 1 hour this medication will start working. Whereas Coumadin, our onset is going to be about 3 to 10 days. So it's not unusual for a patient to be on both heparin and Coumadin at the same time, because the goal is that you take the heparin while the Coumadin is building up to the therapeutic level, and then you can quit taking the heparin altogether and let the Coumadin do its job. The second one is going to be, how long can these patients take medications such as heparin or Coumadin? Alright, heparin. Heparin is for short-term use. So this isn't a drug that you would take for a long time. This is you just take this until your blood reaches the therapeutic level or until your Coumadin starts working. Whereas Coumadin on the other side, some people take Coumadin for a lifetime. Alright? Next thing, when you're given heparin or Coumadin, what lab values should you be looking at? Alright? Because patients that are on heparin or Coumadin will be getting their blood drawn pretty frequently. Sometimes when a patient's on a heparin drip, they are getting their blood drawn every 6 hours. So, if your patient's getting heparin, you want to look at the laboratory value called the PTT. Okay? The PTT should be 1.5 to 2 times greater than normal. Now, I can't give you a straight number to know because heparin is usually weight-based. Okay? The INR is what you'll look at when you are monitoring the effectiveness of Coumadin. And you want the INR to be about 2. Okay? The next thing is Antidote. What if you've given too much heparin, or what if you've given too much Coumadin? What are you going to do? Well, if you're given too much heparin, then you want to give a drug called protamine sulfate. Protamine sulfate is the antidote for heparin. If your patient's taken too many Coumadin pills, then you want to give vitamin K. That's the antidote. The next thing is, what routes can you give these medications? Alright? Heparin heparin can be given two ways. Like I said before, you can give it IV, so you can give a heparin drip, all right? Or you can just bolus it and give it straight through the IV. Or you can give it subcutaneously, meaning that you're giving an injection into the skin. Whereas Coumadin can only be given PO, or by mouth. Now, what if NCLEX asks you? What if they say, your patient has developed a clot in the left lower extremity. Can you give heparin to dissolve the clot? What's your answer going to be? Your answer is going to be no. Heparin doesn't dissolve clots. It's only a blood thinner. It's only an anticoagulant. In order to dissolve clots, you need a clot buster. Coumadin, as well, is just an anticoagulant. It will not dissolve a clot that is already developed. So be careful with that question. What if NCLEX asks you, you have a patient that's 22 weeks pregnant. She comes into the hospital and is put on strict bed rest. Can you give heparin to this patient? What do you think? The answer is going to be yes. You can give heparin to a woman who's pregnant. What about Coumadin? You think you can give Coumadin? That answer is going to be no. You cannot give Coumadin to a woman who's pregnant. So that's my quick rundown of heparin and Coumadin. Remember that if your patient's on a blood thinner, you want to also put them on bleeding precautions, which means that you want to try to prevent them from exposing their skin to any cuts in any kind of ways. So no straight razors, no flossing, only soft toothbrushes. We're checking the skin for bruising, for hematomas, for active bleeding. We're monitoring nosebleeds. We're being very careful because their blood is very thin. Even if you do a blood sugar, you'll notice that it'll take a long time for the finger to stop bleeding because that blood is so thin and the clots are being prevented from developing. Also, herbal medications really quickly. If your patient's on a blood thinner, you need to be careful if they're taking herbal medications such as garlic or ginkgo biloba because that thins the blood too. So you don't want your patient to be on two different kinds of blood thinners, all right, that are going to be long-term blood thinners. So, again, that was my quick rundown of heparin and Coumadin. I hope it helped you. Continue to study with ReMar Review. I love doing this. I love you guys reading the blog and studying with me. Have a good day. I'll see you soon.